In this video, we're discussing a deeply sensitive topic, the devastating effects of parental betrayal trauma. If you're watching this, you may have experienced the profound pain of being betrayed by a parent or caregiver. It's important to understand that these feelings are a natural response to your experiences, and you have every right to feel the way you do. Parental betrayal trauma is when a parent or caregiver fails to meet a child's expectations or lets them down in a significant way, leading to feelings of intense disappointment and betrayal. It is not what the parent did exactly, but what the child believed the parent would do, and then that confidence in their belief is broken by the parent. For example, a parent may repeatedly make promises to a child, then consistently break these promises, making the child feel they are not important. Or the parent may constantly criticize and humiliate the child, making them feel worthless and ashamed of who they are. The most common parental betrayal trauma children experience is neglect, where a parent fails to meet the child's basic emotional and physical needs. This can include not providing enough food, shelter, attention, or love, leaving the child feeling unimportant and uncared for. It is normal for a person who experienced inconsistent love and emotional support as a child to, as an adult, struggle to trust others, causing you to feel anxious about whether others will be there for you when you need them. Many survivors are afraid to open their hearts and fully love someone on a deep level, and may even pull back when their partner shares their emotions or asks the survivor to share their emotions. For the survivor may have built a wall around their heart to protect them from the next betrayal. Some survivors suffer from constant fear that their partner no longer loves them and will leave them, causing them to become clingy and frequently needing to be assured that their partner still loves them, which can put a lot of strain on the relationship. When parents betray a child's trust, it significantly impacts their self-esteem, making them feel inadequate and worthless. It is normal for survivors to feel they are only worth what they can do for others, and that their needs and feelings are not important. A common negative belief is that they have to earn other people's love. Many survivors struggle with shame and feel they are inherently flawed and unworthy of success or love. No matter how successful they are, they may constantly look back and feel as if they could have made better decisions and have done better in life. Procrastination is a common issue for many, often more due to the fear of being successful. Some will unconsciously self-sabotage when they have some success, or feel guilty for being successful while others have less than them. It can be hard for survivors to demand a fair price for their efforts or work, especially if they feel the task came easily to them. When your trust has been shattered as a child, you grow up viewing the world as dangerous and see potential dangers and problems others just do not see. Many survivors struggle with chronic depression, anxiety, and persistent feelings of sadness, hopelessness, and worry. It is common to constantly feel on edge and waiting for the next hurtful event. Some find it hard to sleep as they lay awake at night, worrying about even the smallest of things, or about things that may happen years in the future. Staying in the moment and enjoying life is hard for many. Instead of being excited about an upcoming holiday trip, many are trapped in their mind, where they go over one thing after the other that could go wrong. Some develop PTSD or complex PTSD, where they might relive childhood traumatic betrayal experiences vividly as an adult when triggered. Survivors of parental betrayal trauma often struggle with emotional dysregulation. It's normal to experience intense emotional responses like anger, sadness, or fear in reaction to events that might seem like overreactions to others. Unexpected emotional fluctuations are also common. Survivors may feel happy and upbeat one moment, only to suddenly feel sad, anxious, or depressed due to unknown triggers. Some may unexpectedly feel as if an unseen force closes in on them and causes intense shame in them that can see them curl up in a ball in bed, unable to move, without knowing what caused it or why they feel ashamed of themselves. Expressing emotions can be challenging, as many fear being mocked or dismissed, making it hard to ask for what they need or stand up for their rights. Some may even feel ashamed or guilty for having these intense emotions, and can even feel ashamed for feeling ashamed of themselves. It is common to feel overwhelmed by these intense emotions and feelings of worthlessness. Many reach for ways to suppress or cope with it, such as overeating, shopping, alcohol or drug abuse, or excessive sex. Some survivors shut down emotionally, leading to numbness and detachment, making it difficult to enjoy activities they once loved, connect with others, or even making decisions. In severe cases, they might struggle to find any joy in life, feeling that there's no point in living or striving for success. Internalizing the betrayal often leads to believing they are inherently flawed or unworthy of love and respect. Many feel driven to prove their worth, sometimes achieving immense success in hopes of getting recognition or praise from their parent. However, when they ultimately realize that they will never be good enough, no matter how hard they try, it can lead to a total disinterest in life and success. This realization can trigger a crisis, causing them to lose interest and joy in their achievements and leading them to let everything slip away. It is common for survivors to blame themselves for not meeting their parents' impossible standards. They might continually question what they did wrong and replay scenarios in their mind, imagining how they could have done better or made different choices that would have resulted in a better situation. For many, no matter how successful they become, they may always feel they could have done better, making the mistake of applying their current knowledge and experience to their past actions and expecting their past self to have made the same decisions that they would make now. It can be hard for them to appreciate their accomplishments and see themselves as a success. It is normal for many to look past their positive points and see only their failures, and then conclude that they are not worth having a romantic partner or friends. Trusting others and life itself can be extremely difficult for many survivors. This often makes it hard to open up and be vulnerable with partners or friends, hindering the formation of deep emotional bonds. Many survivors will try to avoid social interactions, preferring to have a few close friends they know and trust, rather than making new friends. Or they may drift between groups, always welcome, but never truly feeling part of any group. Mistrust in others can lead to an avoidant attachment style, where they shy away from intimacy or close relationships to avoid further betrayal, resulting in self-isolation and feelings of loneliness. Survivors may also become possessive over their partners, exhibiting an anxious attachment style where they try to control their partner's behaviors to suppress fears of abandonment. It is not uncommon for people to try to replace the lost sense of worth and love with adrenaline and temporary validation from others. They may seek validation through promiscuous behavior to feel wanted and valued, or they may drive recklessly or partake in extreme sports or dangerous activities to numb the pain inside or fill the empty void in them. Without the confidence that others have their back, many find it hard to take risks, such as pursuing a new job, starting a business, or furthering their education. On the other hand, some survivors may form the belief that they can only depend on themselves, which can make them super resilient and problem solvers, at the risk of becoming loners who struggle to ask for advice or help. For some, having this deep belief that people cannot be trusted can cause them to have an overwhelming drive to prove to everyone that they are trustworthy. They may stick to their word even if it negatively affects them or they know someone is exploiting them. Being trustworthy can become their identity, causing them to take on others' problems and try to fix other people's messes due to a sense of duty or a need to prove their reliability, even if those same people are not there for them. This often results in holding themselves to impossible standards while having very low expectations for others. This double standard can compel survivors to stay in a toxic relationship feeling obligated to support their partner through good and bad times, even if their partner is unwilling to seek help or change. The thought of leaving might trigger intense fear of being seen as a bad person that is untrustworthy or unreliable, as their worst fear may be letting others down. Many survivors feel as if their brains are always in overdrive, constantly scanning the environment for potential threats. It's common to replay conversations in their mind and analyze every word or action of other people, or to run through multiple worst-case scenarios. This can leave them feeling exhausted and experiencing mental overload. If someone betrays their trust, survivors are often harder on themselves for trusting the person than they are on the betrayer. The constant lack of trust can lead to cardiovascular problems, gastrointestinal issues, a weakened immune system, sleep disturbances, and difficulties with focus. Many survivors lie awake at night ruminating over past betrayals or feeling anxious about future interactions, finding it hard to be optimistic and enjoy life. Struggling to trust others is like having a constant war in your mind. One side wants to share your feelings and emotions, while the other side warns that this information will be used to hurt you. All you want is to hold someone and feel safe, but your mind is busy tearing your body and soul apart. Healing from parental betrayal trauma is a journey. Allow your body the time it needs. Keep focusing on the next step that feels right for you, and let your healing path reveal itself. Know that your feelings are normal and valid. You have the strength to heal and thrive. Thank you for watching, and take care of yourself. If you experience parental betrayal trauma, then you may not respond in the classic fight or flight response to abuse, but with a fawn response. Learn more about the fawn response by watching the video suggested to you right now.